you have to pay for just their health insurance premiums. That's before their deductible starts. And in some states, it's close to 40%. Think about that. That's invisible to people because a lot of it comes out of their checks, paid for by their employer. But think about that burden that all of us face. Now add that to the fact that 9 out of 10 new jobs don't even offer health insurance. So you and your kids and your grandkids are going to need to find another way. So let's talk about that other way. To do that, I'm going to invite out 2 great guests onto the stage and invite them to come join me. I suppose I should say who they are.
Now joining Andy Slavitt, John Kasich, former governor of Ohio, from 2011 to 2019, and CNN's senior political commentator, and Steve Beshear, former governor of Kentucky from 2007 to 2015.
You have to pay homage to Bob Schieffer. I mean, you can't be anywhere without talking about the king. He's a great man. You didn't give him a round of applause. How about giving Bob Schieffer? All right. 2 governors, 30 minutes. Yeah, right. Healthcare talk. I'm gonna just do a very brief introduction because you know both these folks are. Governor Kasich, governor for 8 years in Ohio. I think served 9 terms in the House before that. Chaired the Budget Committee. Got real budget chops, so we can talk about healthcare costs. Steve Beshear, overlapped 27 to 2015, served as governor of Kentucky, neighboring state. What I say, because I think you can read all about their backgrounds and things you don't know, what I think I'd say is that these are 2 people who do not follow the script. They write their own scripts. Governor Beshear, the southern state, very poor state, decided to take matters into his own hands, and unlike a lot of other southern states, decided to fully implement the ACA. And I think, he correct me on the numbers, Governor, but brought the uninsured rate down from something like 22% to 8%. Governor Kasich, when very few Republican governors were doing so, decided that it was in the state's best interest, in his view, for a variety of reasons, he can explain, to expand Medicaid. So these are folks who I think you will not hear can talk to a point from, but you'll hear, I think, real great perspective. So welcome.
Thank you. Thank you. And I might point out, I'm a Democrat, he's a Republican, and we actually talk to each other.
So, Governor Kasich, very few people have more budget chops than you as a budget hawk. At the same time, and you can correct me if I get this slightly wrong, I've heard you describe healthcare in moral terms. Talk about healthcare as a moral issue. How do you square, what is the value of the moral issue in healthcare? How do you decide how much to commit and how to balance that trade-off between the real budget realities of healthcare and what you consider to be this moral issue?
Well, because I put myself in other people's shoes and I think about the way that I would want my family to be treated and the ones people I love. And could you imagine not having health care? I mean, how would you, I don't even know how you would function without it. It'd be harder to go to work, you'd be sicker, and all those things. But with Medicaid, when we expanded it, we were able to take and I saw Gary speaking on the video I watched in the back. We took our Medicaid growth from 8% down to, I don't know, 3 or 4%, while expanding the program to 600,000 people. So how did we do that? Well, we took on a lot of special interests, and one of the biggest fights that I had was with the nursing home industry, because I actually had a crazy idea that if people could stay in their home instead of being forced into a nursing home, they ought to be able to do that. And we also took people out of the nursing homes who didn't belong in a nursing home so that they could be in their own home where they would be healthier and happier, more secure. And we did a number of things. We rebid the coverage plans, we reduced the total number, provided more competition, got into the issue of coordinated care, which is absolutely critical, and used all the tools we could to reduce costs. So as a result, 600,000 people now have health care who didn't have it before. They're being treated for mental illness and drug addiction. And a lot of folks now who are getting health care can go back to work. They're actually signing their kids up who hadn't been signed up before. So it's working out great, but you have to stay on top of it. You have to be creative, innovative, and you can't let special interest groups try to tell you what to do. And when I consolidated the total number of plans that were providing Medicaid, I was sued because somebody got left out. And they came to me and said, well, you know, the courts traditionally rules against the government, and they're probably going to rule against us. Maybe we should settle that plan. I said, well, I don't settle with hell. I'm not doing that. Let's just go to court and see how it works out. And we ended up winning. So all these things, now we didn't win everything because in the later years, the nursing home industry was so powerful in Ohio, and they've disrupted some of the things that we wanted to do. But we also combined behavioral, physical health, I mean, all the things that make sense. And so by being creative, innovative, we still can provide better services at a lower price.
So you were dealing with, you were in many respects ground zero for the opioid crisis starting to emerge. That was a lens I think I saw you take sometimes. So do you take this sort of what's the right thing to do lens first and then say, okay, now we've got to be smart about it? Or do you figure, you know what, we can't afford everything we want, so sorry, love to do that, but can't?
Well, but I think we're thinking the wrong way. When we talk about entitlements in America, you know, I was the budget chairman when we balanced the budget, had surpluses. In my state, we were about 20% in the hole, and now we have 89 cents in a rainy day fund, now we have $3 billion. And we provide more services to more people. You have to think of, in the 21st century mindset, that you can provide better things at lower prices. You just got to be creative, innovative, use technology, and think aggressively. So let's talk about opiates for a second. We had a problem. You would think that, and Kentucky had a problem too, but we had a problem because we had pill mills, and it created a culture in Southern Ohio where these pill mills became the order of the day. I was astounded when these women came to me with pictures of their sons and daughters who had died in high school because they had died from opiates. So the Attorney General, who's now the governor, and I went after doctors. Some were prosecuted, others had their licenses taken away, and that was the start of our war against opiates. Now we have, after 1 year, studied the practice patterns of doctors, and now you cannot, as a doctor, except for extreme circumstances, be able to prescribe more than 7 days of opiates for an adult and 5 days for children. Now what's happened? In the last year, 17 to 18, we've had a 30% drop in the number of opiates prescribed, 325 million fewer doses, and at the same time, we're at an 8-year low on deaths. And so we're moving in the right direction, and we've taken with that treatment also. Our biggest challenge now, probably the biggest challenge for most of the states, are street drugs that are laced with fentanyl, which is just absolutely deadly. So our highway patrol focuses on trying to bust the people who are selling these drugs. But in terms of prescribed drugs, where we can really have a say, if our pharmacy board, our medical board, everybody is working in the same direction, and I hope it continues now, and I have no doubt that it will. And we're beginning to win the battle.
Well, thank you for your leadership there. And I think, as you mentioned before, Medicaid provides, I'm not sure what the number is in Ohio, but nationally something like a third, 40% of all opioid treatments come through the Medicaid program. Governor Beshear helped frame the issue as you started to take things on in Kentucky. Poor state, conservative state, not a state that is generally speaking, a reputation for wanting to give more things to more people, yet you decided to take very bold action.
Well, if you would have told me in 2007, Andy, that when I came out of office in 2015, I'd have been known as a health care governor, I would have told you were crazy. Why? Because really, most states don't have the resources necessary to make a huge dent in this whole issue. I mean, we were doing small things, and they're important things, like adding more kids to K-SHIP and these kind of things. But, and then along came the ACA, and it just kind of dropped in my lap. And, you know, our folks said, well, what do we do? Well, I'll tell you what my political folks said. They said, don't touch it with a 10-foot pole. You know, the president only has about a 30% approval rating in Kentucky, and it'll kill us. But, like John Kasich, I looked at it differently. You know, number one, it wasn't morally the right thing to do because, my God, when does a governor ever have a chance to ensure that every Kentuckian would finally have affordable health care? And if I pass that up, shame on me. And so we got our folks together and very quietly planned the implementation of our own exchange and to expand Medicaid. You know, making the decision to do your own exchange was pretty easy because all of our providers and all the stakeholders wanted to do it. But expanding Medicaid, there was an issue. Not that it wasn't the right thing to do. I knew that. But the critics all said, it's going to bankrupt us. We can't afford it. And that's a legitimate issue on a state budget. And so I needed to have an answer to that. So I went out and got Deloitte. No, I got the first time around PricewaterhouseCoopers. And I had them in and I said, I want you to take a look at this and tell me if I make this decision to expand up to 138% of the federal poverty level, what's it going to do to us and for us from a budgetary standpoint? And so they took about 6 months, and they came in, they sat down across from me, looked me in the eye and said, Governor, you cannot afford not to do this. Because over the next 8 years, you're going to create about 17,000 new jobs. You're going to funnel about $15 billion into your economy. And think of what that will do. It's going to help your budget. And so I had the economic argument as well as the moral argument for this. So we implemented. And as you all know, quite honestly, we came up to that midnight. We crossed our fingers, said a prayer, and threw the switch. And ours worked. And it was great to be a national model simply because something worked. I took it. I mean, honestly, I took credit, and the state took credit for it. But the amazing results speak for themselves. As Amy mentioned, we went in 18 months from over 20% uninsured to about 7.5% uninsured. Our uncompensated care rate went from an average of about 25% down to less than 5%. It saved our